are losing insurance under Obamacare, 2 million in the second quarter of 2017. Hello folks, my name is Jen. I'm from Golden State Times, and today we have a news story. This one comes courtesy of Breitbart.com, and it says that a new Gallup Sharecare poll shows that 2 million more Americans are without insurance this year, with a number of uninsured rising to 11.7% in the second quarter of 2017, up from 10.9% in the second quarter of 2016. So it went up quite a bit, folks. It says the poll stated that 10.9% uninsured was a record low over the period from 2008 to 2017. The story about the poll also noted that the highest percentage of uninsured Americans was in 2013 at 18% before the Obamacare insurance exchange opened. However, also starting in 2014, people did not buy health insurance face penalties enforced by the IRS. Now, these penalties are still going on. Okay, it started in 2014, and they have gotten more and more severe as years keep passing by. Okay, they said, quote, several market factors could be contributing to the uptick and uninsured rate since the second half of 2016. It says that rising insurance premiums could be causing some Americans to forego insurance, especially those who fail to qualify for federal subsidies. It says the poll article stated, quote, furthermore, some insurance companies are leaving the ACA marketplace. The lack of competition could be driving up the cost of plans for customers. So, as they have been saying for a very long time, especially during the election and even up till now, okay, they're saying that there are some states that only have one insurer. Okay, how can you compete? How can the prices go down when there's only one guy? Okay, one guy can do whatever he wants, whatever it wants. It can raise it, it can lower it, it can extend it, you can shrink it, it can do whatever it wants. There is no one to compete against it, so prices can go lower. Okay, now, in some other places, they don't even have a supplier. Okay, they don't have an insurance company in certain areas. You know, and that's what I was talking about earlier is how can you be insured if there is no insurance company there to pay the bill? Okay, what's the whole point of having a insurance card in your wallet? So when you go to the hospital or urgent care or whatever, and they say, okay, do you have insurance? And you say, yes, here it is. And they go, oh, sorry, we don't accept that one, right? They left the state. Who are we going to bill? That is the question. Who are they going to bill? There's no one to bill, folks. So that is exactly like not having insurance at all. And not only that, you're still having to pay for it. Even though there is no insurance, even though there is no one to cover you and no one to pay the bill for whatever is being done to you, they still want their monthly premium paid. And if you don't pay and they take away your insurance and you're uninsured for more than 2 months, here comes a hefty fine at the end of the year from the IRS. That's basically how it works. You are literally being blackmailed into paying for something that doesn't even exist. Okay, it's not even something that you can use for a rainy day. It just doesn't exist. Why? Because there's so many of these insurance companies that are leaving the marketplace for the Affordable Care Act. Okay, it says the article. The article also stated that uncertainty about the future of Obamacare could be a factor as Republicans work this week to put in place legislation that will undo parts of the law. It says that uncertainty surrounding the healthcare law may also be driving the increase, the article stated. President Donald Trump's executive order permitting agencies to waive or delay provisions and impose a fiscal burden on individuals, as well as prospect of a new healthcare law, may be causing customers to question whether the penalty for not having insurance will be enforced. So what they're saying is that a lot of people believe that maybe there'll be no penalty in the future. So I would rather take my chances, not have insurance, not have to pay for it, even though I can't use it, and hope for the best and hope that at the end of the year in 2000, for the 2017 tax season, I won't get a hefty fine of like $2,000 or more. That's what they're betting on. A lot of people are betting on that. It says the poll also found the uninsured rate has risen 1.9% among individuals who are 18 to 25 years old, and 1.5 points for those who are 26 to 34 at the end of 2016. It says nothing that some people may decide paying a fee to the IRS is less costly than health insurance. And that's very true. There's a lot of people that are saying that, I would rather pay that fine to the IRS at the end of the year than having to pay for nothing over 12 months. Okay. So that's what a lot of people are having to go through. A lot of people have to say, I'm going to end up having to pay to whatever it is, $2,000 to the IRS because I don't have insurance, rather than paying $1,000, $2,000 a month to something that doesn't even exist. Okay. It says that the article on the poll also noted that the success of government-run healthcare relies on redistribution of financial responsibility for one's healthcare costs from individuals who are healthy young people, subsidizing the cost of healthcare for older people and for unhealthy younger people through higher premiums. So they're saying that your high premium, since you are healthy, helps pay for those who are unhealthy and for the older folks. Okay. It says young adults represent a critical demographic in the robust healthcare market, since their premiums help offset the higher cost of older Americans who typically use more medical services. All right. It says the Associated Press reported on Monday that Senate Majority Leader Mitch McConnell, Republican of Kentucky, quote, is seen as a master legislative strategist, but there's no sign he secured enough votes to pass the bill. Now, President Trump, he said that he's been on the phone nonstop, trying to rally people, trying to get support, trying to do this, trying to do that. And they weren't able to get a bill. They weren't able to get a vote before the the July the 4th recess that they had for the holiday. So they're going to have to do it now once they come back. Okay, they have to get a vote from now until August, because they have to do something between now and August. If they don't do nothing between now and August, they're going to get screwed, because remember, the budget is coming in September, and there's a recess in September, and they're not going to go into recess, according to a bunch of people on Capitol Hill. They're not going to go into recess if they don't get that vote. If they do not pass all of the 2018 budget and all parts of it, they're not going to recess until they pass it. Okay. Or maybe they're not going to recess at all. Okay. So they're putting a lot of pressure on everybody to pass these legislations, to pass the budget, and also to get this, repeal and replace of Obamacare through. Okay. A lot of stuff is happening, folks. Okay, a lot of stuff is happening. It says Gallup noted that the results of the second quarter of 2017 are based on 45,087 interviews with U.S. adults age 18 and older from April the 1st to June the 30th, conducted as part of the Gallup Sharecare Well-Being Index. So this is not new news. Well, it is new news, but it's not something that wasn't seen from very far. We all knew that this was happening, but at the beginning, it started happening at a slower pace, right? It's like a virus. It starts going slowly, until it actually goes and just spreads, spreads like crazy. First, it started off in areas that are with, the small cities, small areas, And it's just started to spread and spread and spread. A lot of insurance companies started leaving the Affordable Care Act. A lot of doctors didn't want to, see patients that have insurance through the Affordable Care Act. Why? Because they knew that if they were to see that patient, they're not going to get paid anytime soon. Okay? They need to get paid. The doctors need to get paid. Hospitals need to get paid. Why? Because they have to pay everybody else. Right? You're not going to work for free. No doctor is going to work for free. Okay, so once all these healthcare companies started to pull out, in some states, one stayed. In some other states, none. And you're still stuck with the bill, and you don't pay it, you're still stuck with the penalty at the end of the year. Okay, the ACA, Obamacare, is completely and utterly dead. Okay, it's not on life support. President Trump said a few weeks ago, you know what? Obamacare's on life support. It's dying. It's this. Is that? No, it's not dying. It's not on life support. It's dead. Okay, this was one of the last nails on the coffin. 2 million people out of healthcare. That is an immense amount of people. I think it took Obamacare, I don't know how long, to even come close to signing up 2 million people. Okay, especially since at the very beginning their website didn't even work. It crashed within the first few minutes. So it's just a complete and utter disaster. But let us know what you guys think in the comment section below. If you had Obamacare at any point in time, or if you have Obamacare now and you're dealing with these issues, you're dealing with having the card but not being able to use it because the health insurance company that you were using through ACA is no longer active, or they left the state, let us know in the comment section below, folks. Okay, and if you're the type of person that would rather pay the fine to the IRS than pay for a monthly fee for Obamacare through whatever state you're going through, let us know in the comment section below. Okay, so just please share this on social media. Let people know. Let those that still support Obamacare know, you know what? There's 2 million people out of healthcare as of right now. Why? Because all of these companies are leaving. All of these companies are fleeing. They don't want to insure. Doctors don't want to see these patients that have this type of insurance. It's going crazy, and it's causing more problems than it's fixing. And in reality, Obamacare never even fixed anything. Okay, so like I said, let us know what you guys think in the comment section below. My name is Jen. I'm from Golden State Times. If you guys missed any of our previous videos, they should be coming up on your screen. They're interactive. Click on them. They'll take you to the video you might want to watch. Thank you very much for watching. Follow us on social media. We're going to be really active on Facebook and Twitter now. So make sure to like us on Facebook and follow us on Twitter if you have it. And also click the links in the description below. And I hope to see you guys here next time. If you're new, subscribe to the channel, and I'll see you here next time. My name is Jen. Peace.